Now, 13,000 youngsters need treatment in the North East every year after breathing in other people's cigarette smoke. And now the government has launched a new campaign to increase awareness of the hidden dangers of smoking in homes and cars. Here's our health reporter Sharon Barber.
Every day, millions of children in the UK are exposed to second-hand smoke. In the North East, that number's thought to be 84,000, putting them at risk of increased lung disease, meningitis and cot death.
If you could see what's really there, you wouldn't smoke.
And today, to coincide with this new government campaign, the Royal College of Physicians revealed that over 800 children a day are visiting a doctor with conditions related to inhaling someone else's smoke. The numbers make for uncomfortable reading. Every year, 13,000 youngsters across the North East need hospital or GP treatment for breathing in smoke. 68% of parents admit smoking in the car when youngsters are present. But there's support for change, with 85% of North East adults supporting a ban on smoking in cars carrying children.
So the key message is, if you're not ready to quit, is to take it totally outside. Don't smoke in the car. Just smoking at the back door or smoking in the car with the window open just isn't going to protect children from the really damaging effects of breathing in second-hand smoke.
The new research today also shows that 3/4 of adults had no idea that so many children were affected by second-hand smoke.
I didn't think it was that high, like, passive smoking for children, like, really bad.
What do you think of it then?
Well, it's just made us put my tab out.
I didn't think it was that many, to be quite honest. I think it's disgusting. I don't think that you should be able to smoke with children in the car.
I think it's terrible even to smoke in the house when there's kids in the house.
What would you like to see happen?
It's banned.
Why, I dreaded going in the car. I dreaded going anywhere where it was an enclosed space. Because my brother started smoking at an early age, so, like, if it wasn't me granda, well, after my granda passed away, like, it was him.
Donna from Blakelaw in Newcastle used to smoke around her children. But it was after her own mother died from lung cancer at just 54 that Donna's children forced her to stop.
They'd seen what had happened to their grandma. They were going to school and they were being taught about second-hand smoke. They were learning, you know, a lot more than I'd ever learned as a child. They were seeing the back of my cigarette packet with a picture of a baby breathing smoke or a damaged lung. They told me, "Mum, you're doing this. You know, Mum, you're not only doing this to you, you're doing it to us, and we don't want you to die like Grandma Val did."
Smoking is still the North East's biggest killer, but more people have quit here than anywhere else in the country. Health experts now, though, want to underline the message that other people's smoke is seriously damaging the health of children.
It's frightening. Well, Sharon Barber joins me now. So this is a government campaign, Sharon, but is the government saying we want to ban smoking in cars and homes when children are present?
Well, there is a ban currently being considered in Scotland, and similar bans are in place in countries like Australia and Canada. And England's Public Health Minister, Anna Soubry, says she thinks smoking should be banned in cars carrying children, and she thinks on the grounds of child welfare. And she's supported by organisations like the British Medical Association and the Royal College of Paediatrics and Child Health. But it's not looking likely in the future, in the near future at least, Carol, because a short time ago a spokesperson for the Department of Health told me in a statement that when it comes to smoking in the home or family car, we don't believe legislation is the best way to encourage people to change their behaviour. But it's clear that the government thinks this is a serious issue. This is a big first campaign for Public Health England, the new agency for the Department of Health, to improve the country's health.
OK, Sharon, thank you.